Came to know I had sickle cell when I was joining Form 1 because my parents feared that I was going into a new environment.
And I have sickle cell, also known as SSB.
That I had sickle cell. I actually didn't understand what that was.
Today, we're diving into a topic that's close to my heart, sickle cell disease. This is a personal story about my journey with the disease and why it took so long for me to find out. Stick around to learn more about this often misunderstood condition. Sickle cell disease is a genetic blood disorder that affects the red blood cells. Normally, these cells are round and flexible, but in individuals with sickle cell disease, they become rigid and shaped like a crescent or sickle. This change makes it difficult for them to move smoothly through blood vessels, leading to blockages that can cause pain, organ damage, and other serious health problems. My personal experience. For years, I struggled with unexplained episodes of pain and fatigue. Doctors attributed it to various factors like stress or overexertion, but none of their treatments seemed to provide lasting relief. It wasn't until a severe pain crisis and hospitalization that I finally received a proper diagnosis. One of the biggest challenges I discovered with sickle cell disease is that it's often overlooked or misdiagnosed. This is especially true for people who don't have a family history of the disease or come from ethnic backgrounds where sickle cell is less common. From my experience with the disease, knowing your genotype will help you to determine the right person for marriage. People with AS are strongly not recommended to marry other people with AS. If you start dating someone, it would be the best to find out their genotype during the earlier stage of a relationship before you become close. Here are the examples of genotype compatibility. AA and AA, excellent. AA and AS, good. AS and AA, normal. AS and bad. AS and SS, really bad. SS and SS, the worst. You see, it is important to know your genotype before you start dating people, because marrying someone with incompatible genotype might result in a lot of problems for your children in the future. It is strongly advised you make the right decision. Ignorance towards sickle cell disease can result in serious problems. Usually, people with this illness are not expected to live for long. The level of seriousness varies depending on the person, as well as symptoms and consequences of the disease, but it is known that even in first world countries the average life expectancy of patients with sickle cell disease is 40 to 60 years. The importance of awareness. It's crucial to raise awareness about sickle cell disease so that more people can recognize the symptoms and seek appropriate care. Early diagnosis and proper management can significantly improve quality of life for those living with the disease. If you or someone you know has been experiencing symptoms like chronic pain, fatigue, or frequent infections, consider talking to a healthcare professional about the possibility of sickle cell disease. Together, we can work towards greater understanding and support for those living with this condition. Don't forget to like, comment, and subscribe for more videos on health awareness and personal stories. See you next time.